Let's learn about hospital infection control program. Transmission-based precautions. Transmission-based precautions are of three types: airborne precaution, contact precautions, and droplet precautions. The organization should adhere to the transmission-based precaution at all times. Contact precautions. All visitors should report the nursing station before entering the room. Wear a gown, wear gloves, and wash hands before leaving the room. Contact precautions. The patients should be placed in a private room. The door may be left open. If private room is not available, cohorting or place the patient in a room with a patient having infection with the same disease. Perform the hand washing using the correct technique as per WHO's method. Wear examination gown and gloves while entering the room. Change gown and gloves after contact with the materials. Remove gown and gloves before leaving the patient room. Patient movement should be limited during transport and ensure the precautions maintained to reduce the risk. Use non-critical equipment with one patient only if possible, and clean and disinfect any shared. That is about contact precautions. Regarding droplet precautions like diphtheria, pertussis, meningitis. Droplet precautions occurs by transfer of pathogens more than 5 microns. By sneezing, coughing. So due to the size, they don't travel longer but remain suspended for a longer duration. This makes them less infected, and this is by airborne route. So examples of this is by droplet or diphtheria. By airborne infection, sneezing and remain suspended for a longer duration as compared to droplet. They are less than 5 microns in diameter, and they remain suspended for a longer duration and travel more than 3 feet distances as compared to droplet infection. And examples of airborne infections are tuberculosis, measles, chicken. Transmission, lot of transmission based precautions. Transmission based precautions are contact precautions should wear a gown and gloves. Droplet precautions, the healthcare professional should wear a mask. And the airborne precautions, the patient wears a mask and healthcare professional wears an N95 respirator, and patient is isolated into a negative pressure ventilation room. So that's about what's contact airborne and droplet precautions. For approximately patients, the patients who are very susceptible for opportunity infections, they are placed in they are placed in the reverse isolation. That is, they are placed in the positive ventilation room, so that no air from outside enters the patient room, so that it is not susceptible to any infections. Total isolation or reverse isolation is when immune system of the patient is compromised and highly susceptible to infections. For example, in transplants or lymphoma, leukemia, and chemotherapy, and extensive dermatitis. The requirements are private room, limit the visitors, room air should be filtered. Safer injection and the infusion practices should be followed. One injection at a time, one needle, one syringe, only one time. Volume of flush will equal at least twice the volume of the catheter and add-on devices. 12.9% sodium chloride for injection should be used. Only single dose solution should be used. Use a syringe with a diameter of 10 ml syringe. Flush in pause, flush or start motion. Access port to be cleaned with single use of 70% alcohol or 2% of alcohol. When to flush the cannula after the placement, prior to and after the fluid infusion, prior to and after the blood drawing, and at least 24 hours if not in. Lock the peripheral catheters immediately following each use. In adults, use a preservative such as 0.9% sodium chloride for locking. In units, use heparin half units to 10 units. And consider locking once every 24 hours for intermittent. The guidelines for the medication should include patient name, medication strength, amount of the medication, dilute name, expiry date, and time. Unsafe practices are caused by risky situations and practices such as lack of awareness, overuse, needle stick injuries, lack of clean spaces, reuse of syringes, unsafe sharp collection, faulty techniques, and so clean the workspace. Hand hygiene should be followed. Sterile needles and syringes should be used. Sterile vial of medication should be used. Skin disinfection should be done. Appropriate collection of sharps should be followed, and appropriate waste management. After reconstitution of a multi-dose vial, patient's name, date and time of preparation, time and volume of diluent, final concentration, expiry date, and name and signature of the person who is reconstituted should be included in the. When it should be discarded, and discard whenever the sterility is compromised or it has been opened or assessed. Discarded should be done within 28 days unless the manufacturer specifies a different date. Maximum it should be 10 withdrawal. If multi-dose vial is opened, then it should be discarded as per the manufacturer's expiration date. Beyond use date or date after which has opened, multi-dose should not be used. Now this is the visual infection severity scale for reference to observe pain, erythema, and swelling, and accordingly observe cannula, reinside the cannula or reinside the cannula considering treatment and other such indications. That was about the transmission precautions and practice and other practices. List about linen management. It is an organized approach to managing the collecting the soil. It involves the laundry department, for instance, involves collecting the soil linen, sorting the linen, inspecting the repairing or damaged materials, distributing the clean linen to respective departments, and maintaining the register. How to sort and transport linen from laundry point of view, hospital linen can be classified as dirty linen, soil linen, and infected linen. Dirty linen are used linen without any stains. Soil that is soil with blood and body fluids. Infected are used by patients with some infection. Soil linen should be placed in a water impermeable bag. Bag must be secured with 3/4 full. The bag must be covered and left in a secure place for pickup and laundry sorting should be educated on the correct method of sorting linen, wear the PPE while sorting, and be instructed to minimize handling of wet or soiled linen. Soil linen should be pre-soaked in soap and water and bleach for 20 minutes. Warm water must be used. 1% sodium hypochlorite should be added to decontaminate. Thermal disinfection. Now, temperature of the load should be maintained at a minimum of 65 degrees Celsius for not less than 10 minutes, or at a maximum of 71 degrees Celsius for not less than 3 minutes. Involved in washing linen are heavily soiled linen should be washed separately from the non-soiled linen. Temperature should be adjusted according to manufacturing instructions. Both cold and hot water washing cycles that include bleach helps in reducing the bacterial. Water washing and soap should be used to aid in the loosening the soil. Washing linen at 80 degrees Celsius for 20 minutes with detergent is an effective method for soil, for cleaning and killing most vegetative bacteria. A sour or a mild acidic agent should be added to prevent yellowing of the linen. When the wash cycle is complete, the linen should be checked for cleanliness. It should be stored and stored separately, and if it requires separation, should be wrapped accordingly. Unused linen should be reprocessed after 3 months. That is of the linen. Perform hand hygiene before starting work and should repeat it at every instance as required. Wear a clean clothes, use hair nets while on duty, use gloves, use then smart and safe storing, that is a FIFO principle should be followed. That is first expire, first out, or first in, first out. Stock rotation system should be applied while using food from the refrigerators. Uncooked food items should be maintained in refrigerator temperature 2 to 8. Raw meat and fish should be stored in the freezer between -18 to minus. Color coding of the cutting board should also be followed because it prevents the cross contamination. Use green, for example, use green color for chopping, yellow for raw pulp and others. Clean kitchen should be where it should have good ventilation, it should have a good environment and utensils, and safe transportation of oil should also be followed. After preparation, food should be assembled in food trays. Food trays should be sent to various areas of consumption and should be covered during transport. Wet waste should be segregated. The kitchen waste should be segregated on dry and wet waste and should be disposed accordingly. There are many foodborne illness outbreaks, so it should be notified about the outbreak to the infection control team. Microbiology department should investigate this suspect. Thank you.